Tuberculosis, or TB, is an infection caused by a bacterium called Mycobacterium tuberculosis. Tuberculosis bacteria most often infect the lungs, but it can infect any part of the body, such as the kidney, spine, and brain. If not treated properly, tuberculosis can be fatal. While well controlled in the United States, tuberculosis infection is very common in developing nations. People who have symptomatic tuberculosis are said to have active tuberculosis. Most people who have acquired tuberculosis have no symptoms and are said to have latent tuberculosis infection, or LTBI. Persons with latent tuberculosis infection do not feel sick and do not have any symptoms. They are infected with M. tuberculosis but do not have TB disease. The only sign of LTBI is a positive reaction to the tuberculin skin test or TB blood test. Most adopted children who have tuberculosis have latent tuberculosis infection rather than active tuberculosis. TB is spread through the air from one person to another. The TB bacteria are put into the air when a person with TB disease of the lungs or throat coughs, sneezes, speaks, or sings. People nearby may breathe in these bacteria and can become infected. TB is not spread by shaking someone's hand, sharing food or drink, touching bed linens or clothing, touching toilet seats, sharing toothbrushes, or kissing. Persons with latent tuberculosis infection are not infectious and cannot spread it to others. Children younger than 7 years of age, even those with active tuberculosis, do not pose an infectious risk to others because they do not cough hard enough to spread tuberculosis bacteria. Risk factors for acquiring tuberculosis include spending time with a person who has active TB disease, being from an area of the world where active TB disease is very common, such as most countries in Latin America and the Caribbean, Africa, Asia, Eastern Europe, and Russia. Spending time where TB disease is common, such as homeless shelters, migrant farm camps, drug treatment centers, healthcare clinics, jails, or prisons. A person with latent tuberculosis infection has TB bacteria in his or her body that are alive but inactive and in small numbers. Has a skin test or blood test result indicating TB infection. All children seen in the UCAC receive a TB screening. Has a normal chest X-ray and no detectable TB bacteria in their sputum. Does not feel sick. Cannot spread TB bacteria to others. A person with latent tuberculosis infection should be treated to prevent active TB disease. Without treatment, 5 to 10% of persons infected with Mycobacterium tuberculosis will develop TB disease at some time in their lives. For persons whose immune systems are weak, especially those with HIV infection, the risk of developing TB disease is considerably higher than for persons with normal immune systems. Children are at high risk of developing active tuberculosis. A person with active tuberculosis has a frequent cough, fever, and/or weight loss. Children with tuberculosis may have enlarged lymph nodes, livers, and/or spleens. Most of the children seen in the UCAC have received BCG, or Bacillus Calmette-Guerin vaccine in their home countries. BCG is a vaccine for TB that is not widely used in the United States, but it is often given to infants and small children in countries where TB is common. The BCG vaccine does not protect people from getting TB. Instead, the BCG vaccination prevents people who have acquired TB in their lungs from developing TB at other body sites, such as the brain or bones. If you or your child were vaccinated with BCG, you may have a positive reaction to a TB skin test for 2 to 3 years. This reaction may be due to the BCG vaccine itself. The BCG vaccine is used in countries with high rates of tuberculosis, so a positive TB test is more likely indicative of TB infection. We still recommend routine tuberculosis screenings and have extensive experience in interpreting test results. The TB blood tests are not affected by prior BCG vaccination and are less likely to give a false positive result. If your child has latent TB infection but not TB disease, your healthcare provider will likely treat your child to prevent him or her from developing TB disease. Treatment of LTBI reduces the risk that TB infection will progress to TB disease. Treatment is essential to controlling and eliminating TB in the United States. The decision about taking treatment for latent TB infection will be based on your chances of developing TB disease. While treatment of LTBI has proven effective at preventing development of active TB, the regimen may be long, between 4 and 9 months. Adverse side effects of TB treatment are rare in children. Medication adherence is very important during treatment. Sporadic or incomplete regimens can be ineffective and can lead to drug resistance. Children with active tuberculosis require treatment. To guide therapy, clinicians will often attempt to isolate tuberculosis bacteria from the child. This often requires a 2 to 3 day hospitalization. Treatment is initiated with at least 4 drugs. This may be reduced to 2 drugs after an initial period of treatment. TB treatment courses are 6 months or longer. Adverse side effects of TB treatment are rare in children. Clinicians will recommend that the child be seen regularly during therapy. Blood tests may be sent occasionally. Medication adherence is very important during treatment. Sporadic or incomplete regimens can be ineffective and can lead to drug resistance. Treatment of LTBI or active tuberculosis should cause minimal disruption to family life and should not affect school, travel, participation in extracurricular activities, or other aspects of daily life. Untreated tuberculosis infections in children can be devastating. When treated appropriately, the vast majority of children do very well and the risk of tuberculosis relapse is low. University of Chicago Adoption Center partners with families to provide compassionate, state-of-the-art care to all children, especially for children with special needs. Our care team can assist with both pre-adoption assessments and even provide in-country consultation when necessary. Our 5-visit post-adoption evaluation helps families welcome a new child into their home while synthesizing disease-specific information and integrating the care of this child into normal family life. The post-adoption evaluation includes medical, developmental, and behavioral care. The Adoption Center is part of University of Chicago Medicine Comer Children's Hospital, with access to the highest quality pediatric infectious disease subspecialty care. Our care team accesses the most current national guidelines and research involving the care of the child or adolescent living with tuberculosis. After the Adoption Center's 5 adoption visits, your family may choose to continue your child's care with our team or may choose to transition to a local community provider. Families who move on to a local community provider will receive a transitioning packet for the pediatrician, giving a background to your family's story. If needed, the Adoption Center team is able to provide long-term care. Whichever path your family takes, know that you can always come home to Comer.